Hi everyone. Today we've got a very interesting speaker with us today, and one of the foremost authorities on senior living and the experiences for senior operations in Thailand, Dr. Nart Fongsmut, Director of LivWell, Medical Director of Chiva-Som International Health Resort, Board Member, and the Thailand Elderly Fund. So thank you for joining us today, Dr. Nart.
Thank you, Janice.
We're very happy to have you here. And looking at the care sector, we wanted to find out more about your experiences. But just before that, can you share with us about your organization and how do you look after seniors in Thailand?
Yeah, for now, I'm working for a private sector called LivWell Living. LivWell is a senior living operator which has the investment from the real estate developer into this company, because in Thailand, real estate developers are getting into this segment of senior living, and without a qualified senior living operator, this type of project of senior living will not be possible. Many people think that you just build rooms or buildings or houses with universal design would be enough for the senior, but it's not. In order to take care of the senior very well, you need to take care of their lifestyle. You need to be able to take care of their health, their lifestyle, their activities, and all other things, so many other things. But the hardware is just part of senior living.
Yeah. So you mentioned so many things that you have to look after that is different from what real estate developers think about senior living. What is the most common advice that you give to real estate developers who would like to work together with you?
Yeah, there are three parties to get together in order to be successful in developing senior living. You have a real estate developer, you have a person who is keen on hospitality services, and you have partners working in the health and wellness services. So if you can team up these three parties together, it would be a successful senior living project.
So, you were actively involved as the pioneer behind Sarang Kanaviv, the Red Cross Senior Living Project. Tell us about this particular project, when it started, and what do you feel was your biggest contribution to this project?
This is one of the first senior living projects in Thailand. It happened more than 20 years ago. It started by the Thai Red Cross. Actually, they were just aware that the trend of aging population is coming, but actually at that time we didn't really know needs of the senior living in the senior living. So we started out Sawang Kanivet, home for the elderly, for the middle income Thai elderly. And we from setting up that project, we learned a lot from that project. Since we are ahead of time, we learn the specific needs of the Thai elderly, and the way they live, the way they adapt from living at their homes and then moving into the senior living, and how we can promote the community, healthy community for active aging for the residents. So after finish Sawang Kanivet was the model for other senior living developments in Thailand. So some other government projects also based on the experience of Sawang Kanivet, and also for the private sectors as well. So I moved along to work with some private companies developing the private senior living for the upper scale, higher than Sawang Kanivet. Sawang Kanivet is more of welfare for the middle income Thai, but for the private companies, they are targeting a little bit higher segment for the same, giving the healthy lifestyle, active aging, healthy senior to be able to stay independent for the most of their life and being dependent as short as possible. But working with the private companies, they are providing a little bit more luxury life, like bigger rooms and more activities, health promotion activities, or some social activities as well. But basically the same concept, keeping the elderly living with us to be independent as long as possible.
We want to keep the elderly as independent as long as possible, and we want to give them a community that promotes healthy lifestyle. But at the same time, we have, a lot of perhaps perception about the idea of healthy living, and we want to give them choice, person-centered care. What if you meet residents who don't want to exercise and they don't want to do the activities?
Yeah, that's a very good question. We cannot force them to join our activities, but we try to convince them with examples, a little bit by a little bit. And usually, the elderly living as a residence, they if they like or they trust our team, they would gradually follow our recommendations. So it takes time, and you need to persistently try to convince them to join your activities.
Well, it sounds great about having all these activities and the environment. And you touched on about how having a team is important to
Yes.
run the activities. How do you think you envision yourself as a care leader? What is your care leadership philosophy that makes other people want to join you, to work together with you?
Yeah, I think it comes from the success of Sawang Kanivet. People are aware that it can be a model of Thailand, and people are hearing that senior living is a trend in Thailand, and it's a good opportunity working in this sector, especially the first group of getting into this business. So I was able to convince people in various sectors. My operation manager, she's from Thai International. She used to be in the hospitality industry, with a background in nursing care, and then she decided to join me because it's a challenge for her. She also has older parents at home. So usually people who work with the elderly, they usually have senior parents, senior relatives at home. Then they are they have some kind of care in their heart for the senior as a natural personality already.
And I think you're also greatly inspired and influenced by your mother and how you want to better look after her. And what are some of the ideas from interacting with your mom that makes you feel would apply quite relevantly to the care sector too?
Usually, the new services that I develop, I use it on my mom first, on first hand, because if it works with my mom, it would be good enough for offering to other seniors. It is an advantage of having senior mom just like you. So we have the passion of taking care of seniors, because along with the line that with our work, whatever we do, we offer to our moms as well. So so the standard of care and services that we are providing is up to the standard. I always tell people that all these services that you are getting offered from us, I'm using with my mom. It's the standard that I'm using with my family members.
And how different do you think it is when you're trying to explain to someone about looking after seniors and creating a great environment for them? How different is it for looking after seniors compared to other types of customers out there?
You need to understand the psychology or the mentality of seniors. if you understand the way they think, then you can gear your services towards their needs. You cannot force them to change. We all understand that we cannot force them to change, but gradually, if you offer something good to them and they trust you, they like you, and they believe in you, they gradually change their lifestyle. That's a way of managing seniors in my business.
It looks like a very unique approach. Then my next question is, how do you identify the right staff to hire in order to continue building your senior living business?
Yes. As I mentioned before, from the reputation that I got in this industry, and younger generations and younger staff, they are looking for choices of work. Instead of working, just like my physiotherapist, instead of working in the hospital with, they are treating diseases only. Here, when they are working with senior living, we are approaching health in a different angle. We are doing health promotion and preventive care more to the elderly for them to stay, healthy along the way. So it's a paradigm shift from medical paradigm to wellness paradigm. And those who get to understand the wellness paradigm, they will be willing to work with me, providing exercises, consultation, recommendations on exercise and food as well, in order to keep the senior healthy.
What's your care philosophy to keep the senior healthy? Like, how do you summarize your care philosophy for people who work for you and people who want to work for you in future?
Yeah, this is a very good question. I don't treat diseases. I take care of the senior holistically. So it's every aspect that happens in their life, even families, the living environment, their health, their friends, their mental health and spiritual health as well, and that social life. So it's holistic, and that you take care of them. You pay more attention to their needs. You spend more time with them. Like we discussed before, when you see a GP, you have 10 minutes to talk to a GP, right? Usually at my senior living, when the physicians or nurses visiting the residents, we spend more time and we do deep listening. We listen to them a lot. We don't go there to instruct them to do 1, 2, 3, but we listen to their needs, to their view of life, and they respond to their needs. So it's a lot of listening that we provide to the residents.
And we listen also improve their being in the environment that you're looking after them. A particular senior whose life has improved since living together with your community?
Yes, I have one case. There's an uncle who is 90 something. He has his own caregiver living in his own condominium unit. But before us, his health is going down like this, even though he has a very good caregiver, because he's not interacting with other people. He's not coming out of his room. But when we come in, he joins our activities. He even joins our aqua exercise with other female residents as well, and then his health, physical health and mental health are getting better and better. And then when COVID came, he joining our activities. And when there's an ease on restriction on COVID, he gets back to our exercise activities. His health is back. That's really clear that being able to meet other people, to communicate and to interact with other people help a lot with your health, with our support.
And from your knowledge and research as a medical doctor too, how has this improved the reduction of symptoms of dementia or the onset of dementia?
Yeah, I always say that, loneliness is the disease of the aged. Is additional to the geriatric syndrome, which are some, symptoms and diseases of the age. But loneliness is one specific disease. So, in order to avoid, dementia or Alzheimer's, there mustn't be isolation for the elderly. Social isolation is very important. So if you can, bring them, bring the elderly out of that living units to meet with other people, doing some exercise, especially brain exercise, like brain gym that we are offering to our residents. But even with our brain gym, just to see other people, have a discussion, have a conversation with other people, it would help stimulate your brain. So when you get old, I usually recommend, not to get isolated. You need to keep your company. When your kids are away, when they have their own families or they travel abroad, working somewhere else, don't stay isolated, even though you have your husbands or wife, but just two person sticking together is not enough. You need a very big circle of friends. You get back to your friends, your school friends, when and you can organize activities together. Just like this morning, we had a very good walk in the park in Singapore with that group of people of various backgrounds, but they get together on specific purpose. The walk was a strategy, but for them to get out and meet other people, and then they finish the walk with the chit chat and breakfast. That's the main part.
Great. Oh, let's talk a bit about quality of life versus quality of care. And what's your observations in the way we are currently looking after older people and how we can improve it for the future?
Yeah. Quality of life is the result of quality of care, but it isn't an equal equation, because I usually focus on the quality of life first, and we get the to understand the quality of life of that person from their independence. They are able to travel themselves, and they are able to do anything independently. So the quality of care is evaluate on the result, which is the independence of the seniors. So our cares would aim for promoting independence of the elderly, just like core muscle promotion for strengthening the balance of the seniors from the activities from our physio. That's the quality of care, which results in the stable quality of life, which is the stability of the senior, not falling or having fractures, which change the quality of life. And I usually focus on the fall for the elderly, because after a major fall, your life change completely. So our quality of care, we will promote the balance and the strength, muscle strength, and neurological and neuromuscular balance of the elderly, not in order to avoid fall.
That's great. And how about technology? We all hear about technology innovations that everybody wants to implement. What are some of the implementations that your technology has utilized to provide better care?
I think in every country we will experience labor shortage, even though we have very trained staff, very qualified staff. But with the help of technology, we will provide a closer look of the seniors better. And then right now at my project, we are working with SCG Do Care. We install the monitor and the base unit and the wearable devices and IoTs, all these things would help us to get all the information needed in real time, and it would help us to take action, whether there's an emergency needs from the elderly, or the wellness or health promotion from the data that we get, and then we plan for the exercise programs for specific elderly.
Great. And how do you use all these data to continuously manage and monitor and track the progress? How important is it to be tracking the quality of the clinical care and the quality of life as well?
Yes, we have monthly report from the system. And I myself, at this stage where we don't have too many, residents, I myself will meet in person with the resident using the monthly report, and we discuss the report together with the resident. It's not me pointing to them that they have to do this, do that, but it would be from the resident, him or herself, to look at the results of the report and then plan for the lifestyle change or for the improvement of their exercise from the data that we got from the system.
So that leads us to, how can we better measure this and then use it to improve the care?
I think something like the feedback system would help because for the time being I'm doing one-to-one, person-to-person evaluation, but in the future, if there's a feedback system being implanted into the system that we are using right now, we would get the evaluation very well, or even feedbacks from or complaints from the residents right away in our records, and we would do corrective methods, corrective actions to the pain points or the complaints, and then the resident will get the feedback from the system as well.
Fantastic. Well, the biggest question facing the care sector today is manpower. How are we going to manage this manpower shortage globally for the care sector? Dr. Nart, how would you convince people who are not in the care sector yet to consider a career in this area?
Yeah, money is not the only answer, but in order to be able to work in this newly developed segment of senior care and senior living would be a challenge for those who have the heart for the care and getting the reward of seeing other people getting a better life, like seeing their own grandparents or their parents or parents having a healthier and happier life. That's some sort of reward for those who work in this sector.
Well, thank you very much, and thank you for joining us here.
CarePage Business is the only feedback platform designed for the health and aging sectors. With CarePage Business, you can uncover powerful customer experience insights, monitor resident or client feedback and complaints in a single, easy-to-use platform, and get the insights you need to drive continuous improvement in services and facilities.